Afternoon, ladies and gentlemen. Thank you for being with us again. Dr. Glynn is going to just take you through the position as is in terms of the epidemiology both now and what we might anticipate over the coming period with some slides. So over to you, Roland.
Thanks, Dr. Glynn. Good afternoon, everybody. Today we're reporting 1,631 new cases of COVID-19. So over the past fortnight, we've reported 27,520 cases, bringing our 14-day incidence now to 578 per 100,000. We've seen a significant increase in numbers of patients in hospital, with a 27% increase in patients in hospital in the last fortnight, with 503 in hospital this morning. And unfortunately, we have 101 people in ICU with an average of 6 new admissions each day at present. So here's a graphical representation which at the end of the curve there shows the extent and speed of increase of incidence over the past 3 weeks, where we've risen from just over 1,100 cases a day up to over 2,000 cases per day on average at present. And this is just another way of showing that. And what we can see here is that last week we had over 14,000 cases. And last week's total number of cases represented the fourth highest weekly number of cases throughout the pandemic to date. There were just 3 weeks when there's been a higher number, and they were at the end of December into early January of this year. Unfortunately, we're seeing increases across the vast majority of age groups, and you can see in particular there in the 5 to 12-year-old age group. We're also seeing, unfortunately, increases in deteriorating profile across the majority of counties across the country, but we've particularly high numbers in Kerry, Waterford, Carlow and Longford, all of whom have 14-day incidences of greater than 1,000 per 100,000 at present. You'll have seen a version of this graph last week, and what concerns us in particular about this graph is that the solid black line at the top represents the number of tests being done each day, and we can see that that has continued to increase day on day over the past week. Now, normally when you see a sharp increase in the number of people coming forward for testing, you expect to see a corresponding decrease in positivity. Unfortunately, that's not the case, and so what we're seeing is a continued increase in positivity levels in the community, and community positivity over the past week is between 13 and 14%. Unfortunately, all of this is translating into increasing numbers of people in hospital. As I said, we had 503 in hospital at 8 a.m. this morning, with 64 new confirmed cases in the past 24 hours, and on average over the past week, there's been 48 new admissions to hospital each day. And again, one of the concerning elements of what we're seeing in terms of hospitalizations is the age profile of hospitalization. So if we go back to May, we were seeing about 1 in 4 hospitalizations were in people aged 65 years and older. We've seen a steady change in that profile, so that today about 1 in 2 people who are hospitalized are aged 65 years and older. And again, all of that's translating into increasing numbers in ICU, with a particularly sharp increase over the past 10 days, in particular in the numbers in ICU, and 101 there as of this morning. One of the questions that we get asked regularly is about the vaccination status of people who are being admitted to ICU. And the key point in this, so this is an audit that was done on all patients in ICU yesterday. There was 97 in ICU at that point. And the key point here is that 42% of cases in ICU had been fully vaccinated, and were 2 weeks since their second vaccine dose. But I suppose the key point there is that 58% of people currently in ICU had not been fully vaccinated. So again, just reiterating the point that what we're seeing in ICU is the people we're seeing in ICU those who are unvaccinated are disproportionately represented. We're continuing to see an increase in the number of deaths being reported. In the past week, we've seen 67 newly notified deaths. So we have a total now of 5,436 deaths to date, with 164 deaths reported to date, with a date of death in September, and a further 116 reported to date in October. And again, this compares ourselves with our counterparts in Northern Ireland and across the UK. And you can see that both ourselves and England have had a particularly sharp increase over the past 3 weeks in incidence. England has noticed or reported a decreasing trajectory over the past couple of days, but again, I think it's too early to read into that, and we'll need to see where that goes over the coming week. Just in relation to our own trajectory and today's cases in particular, 1,600 cases might seem like an improvement. I think it's important to reiterate that that's not unexpected given the bank holiday, and that we may well see a corresponding significant increase in cases reported tomorrow and on Friday. And again, just comparing ourselves with our EU counterparts, we've currently got the 10th highest incidence across the EU, and of note, just 2 countries across the EU have seen an improving profile over the past fortnight compared with the previous fortnight. Our growth rate is roughly estimated at somewhere between 1% and 3% per day at the moment, but again, there's a significant caveat around that given that we've just come through a bank holiday weekend. So, to summarise, unfortunately, our cases, our incidents, and the numbers in hospital and ICU are all continuing to increase. We are seeing significant pressure on our hospital system as a result of the profile of disease at present. We're seeing cancellation of elective activity. We're seeing significant staff absences. We've seen outbreaks in nursing homes. And unfortunately, test positivity is increasing across almost all age groups. As I said, there's a significant caveat around the bank holiday weekend and delayed presentations, and we'll have to see how that plays out over the coming days. But broadly speaking, we're seeing cases and numbers in hospital increasing at somewhere between 1% and 3% a day. Just to reiterate again that our future trajectory is very uncertain, and I suppose the positive in that is that nothing is set in stone. We understand that we're going to have significant pressure on the health system. We're going to have significant high incidence in the short term over the weeks to come, but that doesn't have to remain the case. And again, we're calling for strengthened communication, guidance and compliance across all sectors in relation to the basic protective measures that we've been promoting through the pandemic. Thank you.
Thank you very much indeed, Ron. I'm now going to introduce Dr. Georgie Robertson, from a Senior Research Officer in the Behavioural Research Unit in the SRI. We've heard from the SRI and Pete Lunn on a number of occasions in the past, sharing their behavioural insights derived from their independent research. And Georgie, I'm going to hand over to you now. Welcome.
Thanks for having me. So this is some data from the Social Activity Measure, which is a nationally representative survey that we carry out every 2 weeks, where we ask people to self-report where they've been, what they do when they're there, so whether they're wearing face masks, so whether they're socially distancing, it's well ventilated, and also some perceptions about the pandemic. So what I'm going to talk about mostly today are people's perception of risk and how it relates to their behaviour over the last 24 hours before they did the survey. A technical issue. Thanks. So this is a report of a question where we ask people overall, how risky do you think your behaviour has been over the last 2 days in terms of contracting or spreading COVID-19? So if you look on the chart, this compares people's responses in January and February to their responses now. So it's a 7-point scale. If somebody answers 1, it means that they think they've taken no risk, and if they answer 7, it means they think that they've taken a lot of risk. And you can see that that dropped from January and February to around over half of the population who were saying that they were taking no risk at all, to around 40% now. So if you look at the chart on the right, you can see how that has changed over time. And it's really the proportion of people who have moved from saying they're taking no risk at all to saying that they're taking some risk in terms of contracting or spreading COVID-19 that has changed. There hasn't been a huge change in the proportion who are saying that they're taking high levels of risk. So as we've seen restrictions easing and as we've seen increasing social activity, there is recognition from people that their behaviour has become a bit more risky in terms of contracting and spreading the disease. We also ask people how safe they feel in the different locations they go to and how risky they feel those locations are relative to other places. So if you look at the chart on the left, the blue lines show what rating people give on a scale of 1 to 7 for how safe they felt in that location. So as you might expect, people who've been to outdoor locations give quite a high rating of safety. They feel quite safe from contracting and spreading COVID-19 in those locations. And that compares to, on the right-hand side of the chart, for example, people who've been to events or been to colleges feel that those are less safe locations. Similarly, when we look at how people perceive risk in different locations, public transport is seen as relatively more risky than one's own home or outdoor locations. So the main message is that people do perceive a change in risk and also perceive variance in relative risk and safety across different locations that they go to. We also ask people how much they're complying with the restrictions, and although this has fallen, we ask people to what extent are you following the restrictions and to what extent do you feel that others are following the restrictions. And this has fallen since January but has remained relatively stable since the middle of the summer. We ask people to report on themselves and others because people might be more likely to give a rating for others that wouldn't give for themselves, and people's reported compliance for other people has stayed relatively stable as well. But how does this relate to actual behaviour? So this is a chart that's a summary of our increasing social activity over the last 10 months. And you can see that the total number of locations that people have visited in the past week has risen from about 2.7 in January up to 4.7 now. So a near doubling of the number of locations that people are visiting. And at the same time, the extent to which people are engaging in mitigative behaviours or preventative behaviours when they leave home has decreased. So this is where people have been to a location. We ask them if they wore a mask, if other people wore a mask, if they socially distanced, if they hand sanitised. And we can see that in January, over 60% of people were saying that they were always carrying out these behaviours, and that's dropped to below 40% now. So that's the top green line. And if you look at the bottom red line, you'll see that the number of people saying that they rarely or never engage in these behaviours has risen from around 10% to over 1 in 5 now saying that they rarely or never take these preventive behaviours when they're out and about. So then I said that I'd talk about how our perception of risk relates to our actual behaviour. So to explain this chart, the words down the bottom are the factors that might be associated with somebody's perception of risk. So whether they've had a close contact, how many people they've met, if it was 1 to 2, 3 to 6, 7 or more, the number of locations they've been to, whether it was 1 to 2, 3 to 4, 5 or more, whether they engaged in those type of mitigative behaviours I was just talking about, and whether they're vaccinated or not. So you can see that the higher up a blue dot is, the more likely it is to be associated with somebody's perception of risk. So if somebody has had a close contact, they're more likely to say that their behaviour has carried some risk. If they've met 7 or more people, they're more likely to say that their behaviour has carried some risk. And if they've been to 5 or more locations, they're more likely to say their behaviour has carried some risk. What doesn't have any impact on people's perception of risk is whether they have engaged in things like mask wearing and hand sanitising. So it seems that those types of behaviours aren't being factored into people's perception of the riskiness of their own behaviour while they're out and about. It's more driven by where they're going and by how many people they're meeting.
Good. Thanks very much indeed, Deirdre. So we're now happy to take any questions you may have, and I'm also joined by Professor Breda Smith, who will be known to you from NUI Galway and the Director of Public Health in the West. Zara, afternoon.
Zara King, Virgin Media. I suppose the research is interesting because it kind of spells out exactly the sort of behaviours that people are engaging in. Dr. Houlihan, I suppose, do you want to take this opportunity just to maybe spell out what going back to basics actually looks like? I mean, I suppose it's even things like tapping the hand sanitizer as you go into the supermarket. Are we talking about those levels of basics?
That's absolutely the levels of basics we're talking about. So if I can sort of focus on two things. One is like us as individuals and the things that we might do, things that we understand, as we've heard from Dr. Robertson, about our perception of risk and how that informs our behaviours. So all the basic measures that people take, hand washing, wearing masks, using ventilation, socially distancing, staying away from crowds, being conscious about indoor environments, all those basic things still apply. And it's really important that people keep up those kinds of standards of behaviour. But the second group of things is that when we go out and about, and this is where we come into sectors, you know, whether we're talking about hospitality, whether we're talking about workplaces, schools, universities, whatever it might be, that those environments are made to be as safe as they can reasonably be. And so the examples you've given of the supermarket where somebody goes in, they may be motivated to mind themselves, if you like, as well as possible, but if the hand sanitizer is not full and it's been touched by a number of different people and there's no hand sanitizer coming out, then that actually might represent a risk to you rather than a protection for you. And so we need all of the sectors to play their part in ensuring that they create the kind of supportive environment for us then, each of us individually, who are doing our best to try to practice behaviours that are as safe as possible in terms of preventing infection. I mean, I stress again the point I made here last week, which is that if this virus was spreading without any mitigation at all in the population and there was no immunity, we think the reproductive number would be somewhere between 6 and 8. So we think now the reproductive number is probably less than 1.5. but enough for this epidemic to continue growing at a concerning rate. And so that's a substantial amount of suppression achieved through the high levels of vaccination that we've already seen, and also a continued behaviour. So you'll see in some of the data that Dr. Robertson has presented to you there, that although there's been a slippage in terms of the behaviour, there's still high standards. So 40% of people reporting that they're still practising a high level of, if you like, risk avoidance. And those measures that many people in the public are still taking are keeping a reasonably high degree of suppression, but just not quite enough. And you see small changes in these population behaviours that have just been described to you can lead to significant changes in terms of the overall transmission, such that we're growing as an infection at a rate that we simply can't cope with. And we need to move that to a situation whereby ultimately we can reduce transmission and reduce that reproduction number to down below 1. And so for the individual and for people listening, and particularly people who are vulnerable, it's all those same basic behaviours. And a particular message I think that comes from Dr. Robertson's data is that things like mask wearing and social distancing and all of those basic personal behaviours are just as important, influencing the risk that you are at. It's not just the environment you're in, what you have done yourself to keep up your own personal standard. And we can see with this data that across the population, we're not doing just quite as well as a population as we were doing in relation to all those behaviours at earlier stages in the pandemic. And if we can turn that around a little bit, and if we can find, as we've said many times in the past, if we can have most of the people doing most of the things most of the time, that's the secret. We don't necessarily need perfection, but we need everybody to hear the message, and we need most of the people most of the time to be doing most of the things that we're recommending. And that might be enough to turn around the pattern of transmission that we're seeing, that's putting such significant numbers of people in hospital and leading to significant cancellations of elective activity and all the knock-on effects that we know that's having on public health.
And as we speak right now, there's 15 vacant ICU beds in the country. Like this time yesterday, there was 20. So that's how quickly the beds are filling up, and that's the reality of the pressure on the health service now. I mean, at what point what's a circuit breaker look like for this?
Well, one thing I can say to you about it, just taking the ICU beds as an example, I mean, if we had no COVID, those ICU beds would be full or close to full, because the health service would be operating and free to operate at a level that provided care to people who needed that care, both elective and urgent care and emergency care, such that those beds would be needed. The fact that those beds are now in excess of 100 of them used for COVID means that they're not available for that purpose of providing ICU care for people either who are having planned surgery or planned other urgent admissions. And I'm just giving that one example of a significant effect. So that's having a knock-on effect every day on ordinary people who are not able to get access to significant and at sometimes life-saving surgeries or interventions. And so that's something we have to express a substantial concern about. But right now our focus has got to be on what we can do as a society, and it's everybody has to hear them. It's not just about people who are thinking about going to nightclubs. A lot of the focus in the last few days has been on nightclubs and ticketing and all of that. We need to move the message such that the whole of the population hears that it's about each one of us taking as much as we can reasonably do in terms of basic measures, the basic ones that we've iterated and reiterated, as well as people who have responsibility within the population, leaders of sectors, of businesses, of leisure activities and all of that, to do their best to try to create the kinds of environments for their customers and their staff that limit in as much as possible transmission.
just to reiterate that, what does a circuit breaker look like, or will we need a circuit breaker, do you think, in the coming weeks?
I think our focus now has got to be on getting as much as possible as we can. As I say, like small changes in terms of the population, let's say the cumulative behaviour across the whole population can lead to significant changes in the kind of patterns of transmission that we're seeing. And as I say, it might not take a huge amount of improvement, but improvement across the whole population for us to turn around the kind of experience that we're seeing at the moment in terms of growth of the infection. But the infection is growing at a rate that's concerning us now. And if we don't find means within us in terms of our behaviours, in terms of the environments we're operating in, being made as safe as possible, then we don't want to be in a situation we have to give consideration to what further measures will be needed. We express hope and optimism that the recommendations that we're making to the public and to society, to government, the collective effect of all of those will be to change the experience that we're having. But if that isn't the case, and we can't predict that, then we will have to give consideration to what it is we might recommend.
Can I just ask about the sublineage of Delta? Whole genome sequencing is obviously taking place. How many cases of that do we have in Ireland now, do you know, and is that having an impact on what we're seeing now?
Well, the answer to the first question is in the 80s we've isolated, going back to September we've isolated. It's a small portion in terms of percentage. It's not the driver of what we're seeing. Okay. What we're seeing here is an increase in infection affecting all ages, all parts of the country, every sector in society. That's not explained by a change in transmission. I might ask Dr. Glynn, who's been looking at some of the material published from the UK in relation to this, to say a little more in relation to this particular variant of interest, not concern, interest.
Yeah, so we have somewhere between 80 and 90 cases identified here to date. But in relation to the UK data, and what that's suggesting is that this may have a small transmission advantage over and above Delta, but that remains unclear. And they need to figure out basically, is what they're seeing as a result of an advantage within the virus itself, or is it something more generally to do with where that virus is transmitting and the epidemiological profile in the population in those parts of the UK? So that's not clear. They've done very preliminary analysis on any impact that it might have in terms of severity, increasing people's chances of having to go to hospital. And again, those analyses at this stage would not suggest any impact. But they're crude analysis, and the UK are clear that they need more data before they can come to any conclusions on that. Just more broadly then, at ECDC level, they've said that up to about the first week of October, somewhere between 1% and 3% of cases across the EU were characterised as being this variant. So all of the data is very preliminary. Obviously, we're monitoring closely and obviously particularly closely watching what's happening in the UK.
I suppose in summary what you're saying is it's not making a huge difference in terms of how it's people are responding to treatment and how sick they are, and like overall it's not a massive change.
I suppose the key message at the moment is that it's certainly not the driver of what we've been seeing here over the past 3 weeks.
I would also say that from all of the information, the vaccines work against this variant, number one. And number two, all the public health measures that we know are needed in relation to Delta are the things that will deal with this one, even if it is established that it has a slight transmission advantage.
And just, sorry, when you say, was it 80 cases, you were saying roughly 80 to 90 cases, like, is that how many a week? What's the growth rate on that? Is it?
That's just in broad terms.
Just in broad terms.
To about a week ago, yeah.
Yeah, okay, thank you.
Thanks, Sarah.
Hi, Dr. Houlihan and Ciara Phelan from the Irish Daily Mirror. You were speaking there about going back to basics, and you mentioned staying away from crowds. So just wondering, what's your reaction after seeing the hundreds of people that gathered outside of a particular nightclub on Harcourt Street over the weekend?
I think I know which nightclub you're referring to, but I don't think our focus should necessarily be on that. Look, where we now find ourselves is that anything you want to do is now available for you to do, whether that's socially or recreationally. Workplaces are open, educational opportunities are open, and so on. So the key message now is about how safely we all do that. And it's important that people then hear the basic messages about their individual behaviours. Some of the messaging that we're hearing from Dr. Robertson is telling us that there has been some slippage in both the understanding and practicing of some of those basic measures, particularly around things like personal mask wearing and social distancing and things of that nature. So just because things are open doesn't mean we all have to do them. It doesn't mean we all have to do them at the same time, but a key message is that for you as an individual, if you're thinking about your own risk and you want to influence that risk over a period of time, in other words, you want to try and limit the chance so you're vaccinated, and we hope that the majority of people who are not yet vaccinated will hear the message and will take up the opportunity of vaccination, which is still there. But the vast majority of the population, as I say, are vaccinated. So even if you're vaccinated, there are still risks that attach to both acquiring this virus and transmitting it, and then also having the infection and potentially severe effects of this infection, even if those risks are substantially reduced. So what you can do to think about is your own personal risk assessment. What are the kinds of things I plan to do over the next week or over the next 2 weeks? If I'm involved in some activities, let's say if I am going to a nightclub, when going out to a nightclub 5 or 6 nights of the week is going to carry a much, much greater risk than doing it once and then maybe waiting for a period of time before doing other things. So if we each individually try to manage our own individual risk, limit the extent to which we undertake, particularly the higher risk activities, those that are likely to be associated with higher levels of either transmission or lower levels of the protective or mitigative measures that prevent transmission, that we're aware and conscious of that.
So
and
would you...
even practical things like that, if there are vulnerable people in our households and vulnerable people in our families, we try to limit our interaction with those people, particularly if we've been involved in some of the riskier activities like being at nightclubs.
So if you are at a nightclub at the weekend and you are in a packed crowd queuing outside and you went into a nightclub, would you suggest to those people, if you're vaccinated or not, to lay low? Well, obviously it's to be vaccinated to get in, but to lay low for a couple of days and maybe stay away from vulnerable family members and maybe don't engage in other activities?
Like that, it would be a sensible thing for individuals who are involved in lots of large gatherings indoors, and a nightclub would be a good example of that. And yes, you're right, they should all be confined to people who are vaccinated, and you should have that certification in place, and that's an added protection, if you like, and assurance for people. But there's still a greater risk in terms of transmission in some of those kinds of environments if there are people who are infected, and that you should be aware of those risks, and that should inform then the other kinds of activities that you take over the next period of time, particularly interaction with other people who might be vulnerable.
And what other settings would you suggest then for those people to maybe stay away from?
I mean, a variety of settings will arise for people, and they won't all be organised settings. Sometimes they can be in households where you will encounter crowding, and you will encounter, greater opportunities for risk, and it's for risk of transmission. It's about that awareness that, like, indoor is not as safe as outdoor. If you are indoor, having ventilation is better than not, and things of that nature. And you take all of those things into account in your awareness and in the behaviour that you undertake. As you plan and you think about the kinds of activities that are appropriate and safe for you.
In Dr. Glynn, your figures, there's 42% in ICU that are vaccinated, is that correct?
42% were vaccinated.
Were vaccinated. So when you hear of, there's actually people in ICU are vaccinated, and regardless if they have underlying conditions or not, and for you, Dr. Houlihan, when you are seeing those crowds at the weekend, is that not concerning? Because we're still seeing admissions to hospitals and to ICU, considering even though people are vaccinated.
So, I think the concern, we're obviously concerned about the rising levels of transmission. We're seeing, and you've got the reports of the data that we're seeing in this country. It's been seen in many other countries now in Europe, an increase in incidence. We're seeing an increase in the number of people admitted to ICU and to hospitals. I don't think our focus should be on one particular behaviour, one particular setting. I think what we all have to do collectively as a country is look at what each one of us can do within our individual behaviour. If we can all individually improve, if you like, the extent to which we are practicing the measures that people must be very familiar with at this stage, and recommit to those, and particularly, as I say, those people who have control over the environments in which we find ourselves. So if we're talking about hospitality, if we're talking about clubs, talking about other people's houses, if we're talking about workplaces, that those can be made within reason to be as safe as they can reasonably be for people, and in particular then if they involve admitting people indoors, that there is strict use of COVID passes and verification of people's identity and all of those protective measures that are designed ultimately to protect customers and service users and also staff members, and that those people who are in leadership positions, businesses, society, etc., feel those responsibilities in how they plan and organise, and that we'll see our dispensers, frankly, full again, and our messaging full again, and a consistent behaviour to a greater extent than we're seeing across the various settings in which people now have access to in the way that we didn't have before.
And lastly, Dr. Glynn, you mentioned some counties again that have an increase in cases. Kerry and Waterford were mentioned again. I think Carlow was mentioned there again. And I suppose people would hear Waterford, and it has one of the counties that has one of the highest uptake of vaccination rates. If those figures don't come down and there isn't as public buy-in across the board or across the country, is it the case that yourself on NPHET might consider reimposing restrictions like local lockdowns again, like we saw in the past for Kildare, Laois and Offaly?
So I think that's not where we're at in terms of the messages that we're trying to get across at the moment. Like, obviously, we keep everything under review all of the time, but ultimately what we're trying to get people to do over the next few weeks is to just look again at the behaviours. So as sectors, whether it's shops or public transport or sporting organisations or religious organisations, over the past 18 months we've asked them to have signage, to have particular protocols in place, to have hand sanitizer at the doors, to ensure that there isn't overcrowding in particular settings. And of course, over time, the signage gets jaded, the hand sanitizers may not be filled up all the time, the messaging to the patrons may not be as clear as it was before. So we need all sectors really to just stand back, look at where we are in terms of the disease and say, right, we want to minimise risk to the people using our services, so we need to make sure that all the basic measures from our perspective are in place. And then we're saying to individuals in Waterford and across the country, again, we understand from the data that it's clear that people understand if they meet lots and lots of people that that's a greater risk. People understand that there are some settings that are higher risk than other settings. Indoors is higher risk than outdoors. And I think people really understand that now. But what the data is also telling us, unfortunately, is that a significant proportion of people, when they're going out of their homes, they're not engaging in the basic measures like mask wearing, like hand sanitisation, like not going out if you're symptomatic. And really it's those measures that we want individuals to look at again, and that's to protect themselves and their families. And I suppose a key point over the past week is that we've had huge amount of discussion about hospitality and nightclubs, and that's all well and good, but that's discretionary behaviour, and individuals going to those settings can make choices, and they understand their own health, they understand whether they've been vaccinated or not, and they can make choices about whether they go there or not. And that's open to everyone across society. But there are many elements of society where people don't have a choice. They have to use public transport. They have to go to the shops. And so it's really important that those sectors look again at everything that's in place to ensure that vulnerable people who have to use their services over the coming weeks are protected.
Okay, thanks.
Thanks, Keir. Simon.
Hi, Simon Carswell with the Irish Times. I think people will probably be puzzled by the fact that there's 91% of the population over the age of 12 who are fully vaccinated at this stage, and yet all the figures that Dr. Glynn presented are going where they're going. And I guess, we talked before once about the vaccine bonus, and the biggest bonus seems to be the fact that it protects you against severe illness. But is there a reluctance on the part of NPHET to actually say this is a virus that's spreading amongst the vaccinated, that if you are fully vaccinated, that you can spread it? And is there a reluctance not to say that because of risk of derailing the remainder of the vaccination programme to try and get more people vaccinated?
No, and we've said it. I mean, that's what the science tells us. Unfortunately, in crude terms, the vaccinations have probably done a little better than we might have hoped in terms of preventing severe infection. They have performed and held up their performance really well in protecting people from the severe effects of the disease. If in truth, then they're probably not performing as well as we might have hoped in terms of preventing transmission. So there is an impact on transmission by and to people who are vaccinated, but it's not as great as we might like. And so, yes, you're absolutely right. It is possible for people who are infected and who are vaccinated to be infected and to transmit that infection, and not to the extent that we would have liked. And that has to then be taken into account in our collective behaviour. And so the suppression that we're seeing, and the 91%, I think it's up to 93% in fact now, or close to that in percentage terms, it's very, very high by global standards. The unfortunate thing is it's just not quite enough on its own to suppress the transmission of a virus that has a natural transmission capability as high as Delta. This is a really highly transmissible virus. So we deal with flu on an annual basis, and there is residual immunity in the population every year that limits the spread of flu, and there's seasonality established and all of those kinds of things. But flu is nowhere near as transmissible as this Delta variant, which is about twice as transmissible as the original so-called Wuhan strain that was the first substantial wave that affected this part of the world. So the vaccines developed quickly, really effective and safe, and now taken up in large numbers are what's causing, if you like, the protection that we're seeing, that we have prevented in this country. thousands of hospitalizations, hundreds, if not more, deaths and ICU admissions than would have occurred in this wave by virtue of the high levels of people vaccinated. But what we're not able to prevent through that vaccination is the wave of transmission that we're seeing. And we have no reluctance whatsoever to admit that that's what the data says, unfortunately, Simon. I wish it was different.
What is that level that would be that tipping point where we'd see it coming down? Like, what percentage would we be comfortable at where we might see the case numbers turn downwards?
You mean in terms of transmission?
In terms of vaccination level?
Well, it's not going to turn on vaccination alone, and clearly vaccination alone is not going to be enough to turn around transmission. That we need a continued reliance on. If I can refer you to the ECDC, which you'll be familiar with, produced its most recent set of guidance on the 30th of September, I'm pretty sure, which is guidance for countries in anticipation of winter and the further surges that Europe was predicting and now beginning to experience. And it broke down that response for high vaccination countries like ourselves, low and medium vaccination countries, and the level of dependence that might be required in terms of other measures, so-called non-pharmaceutical measures, so the basics that we've been talking about, like hand washing and sanitisation and all of that, as well as other restrictions that might need to exist. And it's very clear that no country can dispense with a reliance on some measure, some amount of non-pharmaceutical intervention, some level of good behaviour in terms of public health and other protections like COVID passes and things like that are in place here to add to the bonus and the benefit that comes from vaccination, even at very high vaccination rates like we've achieved in this country.
Just
in addition,
Rita, please, yeah.
In addition to that, I think it's really important at the point that you're making there is that irrespective of whether if you are vaccinated, it is possible to get breakthrough infection. So if you have symptoms, it's really important that you stay at home, you get your COVID test, even if that's negative, that you stay at home until you're 48 hours symptom-free, because with the other respiratory viruses, there's still likelihood that you could transmit that. So it is really important, and I think it's natural that we all think when we're vaccinated, we cannot get it, but we actually, there is breakthrough infection now, and it's really important if we are symptomatic that we take all the precautions and stay home, along with all of the other non-pharmaceutical interventions that we have to take when we're well. So it's really important if we're going to a workplace, if we have children going to school, that we adhere to this strictly. So if anyone has respiratory symptoms, the first thing they do is stay home. And then if they need a COVID test, they get a COVID test. Even if their COVID test is negative and they have respiratory symptoms, you stay at home until you're 48 hours symptom-free. And that will really help us with transmission of all the respiratory viruses, preventing respiratory illnesses in all of the settings, schools, workplaces, and also our vulnerable populations, because we do see when we see a surge of infection in our community, it invariably affects our vulnerable populations, our nursing homes, our disability sector, our care homes, our people that are caring for vulnerable people. So all of these are really at increased risk when there's raised levels of transmission in our community. So it's really important that we adhere to all the basic measures, that we are vaccinated, but also we adhere to these basic principles of infection prevention control, that we continue to sanitize our hands, that we continue to wear our masks, ventilate in indoor settings, and if we have symptoms, we stay home.
Dr. Holland, just another potential defence with booster jabs or third doses. For healthcare workers in the first instance, do you think that they're required to protect the health service given the number of staff that are out sick and the pressure currently on the health service?
Well, obviously healthcare staff are in a particular situation. The nature of their work involves them being in part of the frontline response to those people who are infected, and so we're obviously conscious of the importance of doing everything we can to try and protect them. And that's a whole range of different measures. Vaccination in the first instance, high practice of infection prevention control arrangements, and all the supportive environmental measures that we talk about in other sectors, particularly important in healthcare settings when they're dealing with so many vulnerable people. The question of booster vaccination is now under consideration by NIAC for healthcare workers, as you say. There are some of the countries that have introduced that measure, and I know in the most recent correspondence that I have from the chair with the last set of recommendations last week in relation to people over the age of 60, they indicated they were giving ongoing consideration to the question of healthcare workers, and I expect them to have a view on that in the not terribly distant future.
There's a commitment made by NIAC for global vaccine equity and sharing vaccines so that more of the world is vaccinated, even 1 or 2 doses, before we look to giving third doses. There was a discussion today at the McGill Summer School where Dr. Mike Ryan stressed that point. Another opposing voice said that, well, actually we could do both. We can boost our population as well as commit to global equity. What's your view on that? Do you think that we can do both? Do you think we can protect our own population with third doses as well as commit to the global vaccine equity programme?
And I mean, I'd be sensitive to the importance of us obviously playing our part as part of on the world stage, if you like, and in solidarity with other countries. We do all that through our cooperation at a European level, through ECDC and other mechanisms at a European level. Our remit is focused obviously on everything we do in this country, and that's the advice that NIAC gives us in relation to how we best protect the Irish population. There are wider questions that government has to consider in terms of our international obligations, and obviously Mike Ryan's perspective on all this is going to be a global one. None of us can think in an insular way about the control of this particular disease, because it's a disease that, as we well know, does not respect borders and travels easily between different populations. But the remit of both NIAC and myself in terms of advice and guidance that we provide is on the measures that have to be taken to give protection to the health of the Irish public. Then, as I say, government here, just like governments elsewhere, have wider considerations in terms of their international obligations. I may have personal views on those kinds of matters, but they don't fall directly into my remit.
But given the pressure on the health service, there must be pressure now to sign off, and as CMO you must feel that this would be an added protection for the health service.
In terms of healthcare workers, my expectation, as I say, is that in the not terribly distant future there will be a view on the ongoing consideration of the advice by NIAC. What we have done all along is rely on NIAC advice in relation to vaccination. At times there has been an understandable expression of impatience from some quarters about the length of time that it takes, but the sifting and consideration of changing and devolving evidence is something that takes time. And it's really important that time and space is given to people who have that onerous responsibility, because if they don't do that properly, they will be the ones personally to account for that at some point in the future. So it's important that people who are in those processes are given that time and space. And if you look at how the NIAC process has gone, it has been the cornerstone of the advice and guidance that we have had at the centre of our vaccine programme since the very start. We've changed course on many occasions, in response to new evidence about effectiveness, on occasion in response to questions around safety signals, always guided by NIAC advice. And I think that that's one of the central reasons why 93% of the public who are targeted for vaccination have come forward for vaccination, because they've maintained such a high level of confidence and trust in the message that they're getting. And as I say, the source of that message ultimately is the NIAC advice that comes firstly to me and then via me to government. That's the cornerstone of our decision making, and we should keep faith with it.
Thank you.
Thank you.
Grania from the journal.ie. Can I ask about the general message? Once again, the public is being asked to change their behaviours to protect the healthcare service, deal with the COVID-19 pandemic. This is after very harsh restrictions earlier this year, after a really high vaccination uptake rate. Should we not be talking about beefing up ICU and hospital capacity to deal with a surge in COVID-19 clinical kind of cases, instead of asking the public to alter their behaviour again?
I don't think we can do one or others, and they're not alternatives. I mean, we can't see a success of our pandemic management as having enough ICU beds to house people whose illness is so severe that they require ICU admission, when that illness is in the first instance preventable. Of course we need sufficient ICU beds, and there is a question around ICU capacity, and ICU capacity has increased. But if our response to this pandemic was to build enough ICU beds and enough mortuary space to cope with the severe effects of this infection, I don't think we would be serving the public well in terms of the advice and guidance we're giving, when the measures that people can take to protect themselves in many situations are relatively straightforward. So at the moment we're talking about in a context where the economy and society in broad terms is open in the way that it wasn't some months ago earlier this year and over the course of many parts of 2020. How individuals can both protect themselves in the way that they live their daily lives, and then protect themselves and those with responsibility for the environments in which people interact, protect those environments from transmission through the application of simple, basic measures that we know work. And so our primary obligation has got to try and ensure that we promote as much adoption of that as possible, because we can, through those measures, apply the most effective means of dealing with this disease, which is to prevent us from picking it up in the first instance. Once you pick it up, and particularly if you're an unvaccinated person, there is a substantial risk of severe complications that, as I say, are preventable. So having enough ICU beds to deal with, and if, as I think heard some people over the weekend characterise our current policy as a let-it-rip policy, which is absolutely not the case, that this infection is being allowed to or encouraged to spread widely through the population. We would simply have too many people ending up in ICU. So the question isn't about whether there's enough space for them. They shouldn't be there in the first place if we can do more to prevent them from ending up there.
Can I ask Dr. Glynn a question about the incident rate among people aged 5 to 12? I know it was mentioned that it's across all age groups, but it's the highest among that age cohort. Can you explain why you think that might be?
So we are watching that very closely, and we're doing further analysis on that age group at the moment. It's not entirely clear what's driving it in that age group over and above others, if there's something different happening there. And as I said, that's not clear at this point. I think the key message at this point is that across all age groups, we're seeing an increase. Obviously, we will focus on that age group over the coming days to see if there's anything else that needs to be done over and above what's currently being done. But I think the message today has to be to all parts of society to look at the behaviours. Ultimately, there is a message there, though, to parents and to children, but it's a message, just thinking back to the earlier questions, and this time last year, we would have been talking about a contact budget, and we're not talking about a contact budget now. So people can meet with as many people as they want. Children can meet up with as many other children as their parents want. But ultimately what we're saying is that, so if you're going to a nightclub, well then think about the other activities that you're engaging in the days after that. If your children are going on play dates or engaging in sport, think about all of the other activities they're engaging in, and just see, do they need to be engaging in everything that they're engaging in at a point in time, given how high the disease incidence is in the country at the moment? And I suppose a key point as well to your first question is that the reason we're giving these messages, yes, a core priority for us is to protect the health service and protect staff and the health service. But ultimately, first and foremost, the reason that we give these messages is so that people will protect themselves. Because there's a lot of vulnerable people out there, even though they've been vaccinated, they're still vulnerable to the severe effects of this disease. And so ultimately what we're asking people to do is to protect themselves and their families. And yes, of course, the knock-on of that is that will protect the health service. But the core message is to people rather than the protection of the health service in the first instance.
There's no concern that kids...
Sorry, go on. In addition to what Ronan is saying there, and absolutely it is really important that people protect themselves, but in this age group as well, it's very common to get common cold, respiratory symptoms. So it's really important that parents take the responsibility of keeping children with symptoms at home until they're 48 hours symptom-free. If it is symptoms that's suggestive of COVID, they need to get a COVID test. But it's really, really important that that message is loud and clear within this age group, because we know that they are, they're in contact with one another a lot, as one has said. So it's really important that we prevent the transmission within this age group. And this is one area that really could prevent further cases, is by taking this action and keeping children with symptoms at home until they're symptom-free.
So parents keep kids
exactly, yeah, and getting a COVID test if it's suggestive of COVID, and adhering to the guidelines that are then directed to them as a result of the result of the test.
Dr. Holohan, can I ask you about comments by the Minister for Environment, Eamon Ryan? He said that he doesn't believe that there will be restrictions introduced or reintroduced in the coming weeks, particularly before Christmas. Is that a fair prediction to make at this stage?
We all share his view of things, that none of us wants to see us being in that situation. I said on a number of occasions in the past, there are a number of people who've now been infected, whose infection yet has to manifest itself over the course of the next 10 days or fortnight or whatever. But people beyond that point, their infection is not necessarily inevitable. It's not inevitable that infection has to occur. We do have it within our gift. We've shown it in the past as a country, that our collective behaviour, particularly in response to surges of the infection we're seeing at the moment, can turn around and change. And if we can get to that point, through the combination of the measures that we're recommending, both at the individual level and the sectoral protections across all the sectoral settings that people will have access to and have an opportunity to visit now, that we hope and are optimistic that we can achieve a change in transmission such that we won't need to do anything further in terms of measures. Our job, from an NPHET point of view, is to continue to analyse and report on that and to advise on what we see in terms of both disease transmission and measures that we think might be necessary to address that. And we hope and are optimistic that if we can get back, if you like, to some of the basic behaviours and improvement in those behaviours that we've been talking about, that we'll be able to do that successfully over the course of the next number of weeks.
Just finally, the Taoiseach has said earlier the government is looking at testing for those that can't get the vaccine because they're immunocompromised or they might have had a first dose and had an adverse reaction and they don't want to get a second dose. Is NPHET consulting with the government about this?
So you're talking in terms of passes, is that right?
Yes.
Yeah. So there was something we gave consideration, and that a means or a mechanism be found for people who are not in a position to get that second dose, and to see what could be done, and that is being looked at. And it was something that we gave some consideration to, and would share that view that something should be done to try to, because there are some people who, in spite of a willingness, are not in a position to get a second dose for very specific reasons.
Do you have advice to those people who haven't gotten a second dose because they had an adverse reaction to the first dose and are reluctant to get a second dose?
I'm having difficulty hearing your question. Sorry.
Do you have advice for people who...
Advice?
Yeah.
Well, it will be the case for at least some of those individuals, and the circumstances can vary substantially between them. So some individuals, it might be because there are particular medical circumstances, and it may be an individual clinician that you need to consult your own individual doctor as to what your own advice is and your own individual behaviours. But in general terms, a person who's had one dose of the vaccine isn't going to be protected in the way that we talk about in terms of vaccination. And there's just the added importance for you then in that situation of considering the risk attaching to the activities that you're undertaking and taking all the other measures you can to try and limit your own risk of picking up this disease, because you will have greater vulnerability in people who've had both doses of vaccine.
Thank you.
Thank you.
Stephen O'Brien from the Sunday Times. Professor Smith, just to go back to the issue of the cold symptoms, I mean, do you get a sense that clearly there's a lot of factors at work here, increased socialisation and the behavioural changes that Dr. Robertson refers to, but is part of the mix an issue, maybe cold symptoms masking asymptomatic COVID? Is there a sense that that's happening out there?
So I think we have to take a common sense approach to this. We're heading into a winter season. It's the season for colds and flus. So we will all be getting respiratory symptoms, and we need to be able to be ready to deal with that. And it's started already. And I think part of that is if we do have cold and flu-like symptoms, we have to recognise that straight away. If it is suggestive of COVID, we need to get a COVID test and self-isolate and restrict our movements. If it's COVID negative, then we still need to, if we still have our symptoms, we still need to stay home for 48 hours until we are symptom-free, and that will prevent transmission of other respiratory viruses. And that's a bit basic public health measures with regards to respiratory infections. And we are entering into that season. So we're entering into a winter season with respiratory viruses, both flu, RSV and COVID. So we have a multiplicity of, of viruses to try and protect against. And this is the best way to prevent onward transmission, is that if as an individual I have symptoms, that I take the responsibility to, number one, stay home, number two, if it's suggestive of COVID-19, that I get a test. If my test is negative and I still have symptoms, that I still stay home until I'm symptom free. And that will protect our workplaces, it will protect our vulnerable settings, it will protect the community at large and the increasing transmission that is there. In conjunction with all the other basic behaviours that we have to do, like washing our hands, or like wearing our masks, and avoiding crowded spaces if we can.
But is it a phenomenon to any extent that there are people with COVID and other coronaviruses, for example, or the common cold at the same time?
We are seeing the fact, and the international evidence is showing that there is both, COVID and respiratory virus infection, so you can get co-infection. So we are watching the space very closely. As you know, with the pandemic, throughout the 18 months to 2 years that we've been living with it now almost, it's been a continual evolving process. The evidence is growing all the time in different areas, and we have to stay on top of all of that information and evidence and make the best evidence-based decisions with regards to all our policies and recommendations.
Thank you. Dr. Hurlin, you say that your remit and NIAC's remit is on measures that can be taken to protect the health of the Irish people, but NIAC did say in that recent communication with yourself that they took the potential for donation to low and medium income countries into account when they were making the recommendations on extending to the 60 to 79-year-old cohort. Would it be helpful if government was more explicit on how it was planning to to donate vaccine into COVAX or to donate to the Third World? Would that pave the way for NIAC to fast forward the booster programme here, do you think?
Well, frankly, there isn't an interaction between NIAC and government in relation to those specific issues, and there was a view expressed in those communications, as you rightly say. And government's remit in terms of our international obligations, I know, is one that the government takes seriously. This country does much more than most in percentage terms, in general terms, in the assistance that it gives to countries that are in need of that assistance. I know there's a general desire, and we'd all share it, I'm sure, as citizens, to do the best we can to try and support other countries. And there have been a number of measures, and this department is cooperating with other parts of government that are actually putting some of those arrangements in place to try to ensure that if it's access to additional vaccine or whatever it might be, or expertises and so on, that can be mobilised. But that just does not fall into the remit of NIAC or me. We have the Department of Foreign Affairs, we have Irish Aid, and a particular way in which government deals with and considers it. So when it has those kinds of matters around our obligations, it doesn't ask me about those things. That's not my field of either expertise or responsibility.
Okay. So you don't think that that's an impediment to NIAC moving on to further cohorts?
Absolutely not.
Yeah.
Absolutely not,
okay.
no.
Last question then, perhaps Dr. Glynn or yourself, Dr. Holan. In terms of the 5 to 12-year-olds, how sick are they? Are they showing up in the hospitalisation figures, for example? And deaths, I mean, we've seen, and I don't know if you have the transparency on this for your own purposes, but we've seen what has happened with hospitalisation rates and ICU rates in the past 3 weeks. Do you have any sense of what's happening in mortality in that period?
So I'll get the hospitalisation numbers for children in terms of how many have ended up in hospital in the last couple of weeks, but the numbers are low. I think our far greater concern for us at the moment in relation to hospitalisation in children is RSV, where we've seen over 300 children hospitalised with RSV in the last couple of weeks. So we know obviously that a very small proportion of children who get COVID will end up unwell and will end up being hospitalised, but the vast majority will either have no symptoms at all or very mild symptoms. And to Professor Smith's comment, given the time of year that we're coming into now, purely from a perspective of children, I think we'd be equally concerned about COVID and RSV and influenza. And again, I suppose I'll take the opportunity to say to parents that the flu vaccine is available for children aged 2 and older. So please go and avail of that. It's a nasal vaccine. It causes no discomfort. It's very easy to get for children. And I'd encourage people of all ages who should be getting the flu vaccine to avail of it over the coming weeks, because it's clear from what the ECDC has said that there is at least the possibility of a significant influenza season this season. So we should all take the opportunity, where appropriate, to get protected.
Thank you. And on mortality?
In relation,
has there been any change? Maybe it's not visible. Any change in the rate of death from COVID in recent weeks?
No, not significantly. But that's not to say that the death rate that we're seeing is not significant. We're seeing 3, 4, 5 deaths a day on average. We've reported somewhere between 60 and 70 new deaths notified last week and this week. And I think I said 164 in September and rising, and 116 in October and rising. So they are very significant mortality figures. When you look at mortality per month over the course of the pandemic, they are not insignificant. I suppose it...
Very much so.
Exactly. So when we come back in December and January and we're looking back to the total mortality for September and October, those numbers will be significantly higher, unfortunately.
Thank you.
Stephen.
Sharon McGowan from the Irish Daily Mail. Just going back to the ICU figures, 101 in ICU with COVID, and I know you mentioned earlier that you wouldn't be serving the public well if the strategy was to just increase ICU capacity and hospital bed capacity. But just to clarify, are you saying that we don't need any extra ICU beds?
Oh, no, I'm not saying that. And
Okay.
in general terms, from a population point of view, there is a plan to put more ICU beds in place, and there's been an increase, I think, over the period of the pandemic, over the last 18 months, of somewhere in the order of 20-25% in terms of our standing capacity for ICU. I might be absolutely precisely correct on that figure, but it's in and around that figure. So there has been an increase in ICU capacity. I'm simply pointing that, like, we can't look at ICU. So the question earlier was about, should we not just increase ICU capacity so there'll be enough ICU beds and then not worry about public behaviour in terms of prevention? That's what I was responding to. We know there is a reality around the fact that although we prepare in as much as we can to prevent transmission, there will be transmission that will occur that will lead to ICU requirements and hospitalisation. It's at simply a level now. Whether we can cope with it or not is almost not the question. We shouldn't be experiencing a situation where we know we can prevent it, whereby this number of people in the population require admission to ICU from a preventable respiratory viral infection. That's my basic point. But the pressure that it's now placing on hospitals is very significant. With in and around 100 ICU beds, that's a substantial portion of our total capacity at a national level. And many hospitals around the country experiencing significant challenge, such that some of them had to cancel elective activity. And then you'll understand exactly the impact that then has on people who've had cancelled operations or are not able to get into hospital as a consequence because their potential access to ICU or the dependence on ICU is not there. And I'm just giving ICU as just one example of the pressure. It's right across the health services. So whether you're talking about general practice services, emergency services, hospital services in general, ICU services, and social care services, they're all under pressure as a result of the additional burden that COVID is placing on top of a health service that is challenged by the needs that it has to meet from what's left over, if I can put it that way, from the impact of earlier waves and the rising need that will always occur at this time of the year as we head into winter.
Would you say then that the pressure that COVID is putting on the health service, it's symptomatic of greater issues within the health service? And would you like to see maybe additional ICU capacity coming up to winter, given that we are under that strain already?
What I'd say is it's symptomatic of too much transmission in the population. That's what it is. That's where our focus has got to be. There are questions around the healthcare system and how we can continue to do everything we need to do to try and underscore, if you like, the provision of care to an ageing population, a population with increasing potential comorbidities and all of those dependencies. And every healthcare system is in the Western world is challenged with those kinds of things, and we take them seriously, and we have to continue to press on with measures to address those kinds of issues. But right now, the issue that we have to focus on, and our basic message for the public, has got to be doing everything we can to try to prevent a viral infection that we know how to prevent, that is preventable, and is transmitting at too high a level at the moment, and putting simply too many people in hospital, too many people in ICU, and placing an unnecessary strain on public health in the first instance, but also on the health services, and then the knock-on effect of that being that people who need access to health services when they need it, not being able to get it because that capacity is taken up unnecessarily with COVID patients.
Okay, then on to the high incidence among children aged between 5 and 12. Is there any concern there that this is because of schools, and are you guys considering putting back into place the contact tracing measures that were ceased in schools a few weeks ago?
Well, obviously, we're concerned about the rate of transmission in that age group, as we are in all age groups. We're seeing transmission rising in all age groups, but it's been rising quickly in that age group, which is the highest age-specific instance that we have in the population right now. We also see the test positivity. The percentage of people who have a positive test is increasing at a faster rate in that age group than in other age groups. But there are lots of reasons for that. We know that the 5 to 12 age group are not currently part of our vaccination programme. The virus has more opportunity to transmit among people who don't have immune protection through vaccination as compared to others that do. and the opportunities that individual children have now to be out and about socialising at whether it's sport or parties are significant. What we know, and I might ask Dr. Smith to comment in a moment, is that many of our public health teams are seeing that, like, where there are challenges in some schools, those challenges have more often arisen with transmission being associated with out-of-school activities involving school children rather than within school activities. Our general view still is that a significant amount of work has been done in the school sector to try and render that sector as safe as possible. Many of the sectors could learn from the high standard that is being applied in the school environment, but we have to keep a continuing view of what's happening in terms of transmission in that age group, and if we think we need to change measures in response to the levels of transmission, then we'll do that. But we'll keep a close eye on it, as Dr. Glynn said earlier on. Yeah.
Yes, just to, I suppose, to agree with Dr. Houlihan, you know, the rise in the transmission and the incidence rate in this age group is concerning. And that is consistent, as we've seen in the age-specific incidence across all age groups, but particularly in this age group. So it is something that we are keeping a close eye on. We are seeing outbreaks in schools. We're dealing with them. We're carrying out public health risk assessments where appropriate, and the measures that are appropriate to be taken are being taken at the moment. However, it is an evolving situation, as you know, and we are keeping it under, I suppose, very close observation at the moment, and to see really with regards to what our next steps will be.
Just one last question then on the ticketing measures that are due to come into effect for nightclubs and other events. The industry bodies, they've asked for 2 weeks of grace period so they can get sort of set up and get ready. And the government has said no to that, and that these measures are going to be in place by Thursday. I was just wondering, was that a NPHET recommendation?
Well, the NPHET
not to give the 2 weeks grace period.
The NPHET recommendations are contained in the letters, and they're all published, and you can see that you can see what's in those NPHET recommendations. I think in broad terms what we'd say is that, like, so we didn't get into the detail of how individual sectors apply the measures. We really never have. What's important is that individual sectors that know their business far better than we do essentially apply the basic measures that we recommend in if you like, in fact and in spirit with how they are recommended, and do their best to try and ensure that they create within their environments as safe an environment as possible. And then that those sectors, so if you're talking about nightclubs, deal with their parent department, if I can put it that way, that part of government that and agree those measures. And yes, I know that those measures, that I know what the view of government is and the expectation of government is around compliance then and the time periods and so on. That's not a discussion that we've been involved in directly. The relevant sector here, we expect will come into full compliance with what government wishes to see happening in that, because obviously government is concerned and has been briefed by us on the changing situation and just how quickly things can change, and 2 weeks is a long period of time.
Yeah, thank you.
Thank you.
Paul O'Donoghue from Newstalk. Just a quick question. I'm not sure if anyone had heard it today, but Professor Kingston Mills was on the kind of speaking on the same call as Dr. Ryan at McGill earlier today, and he was talking about, I suppose, the kind of end game of the pandemic, and he was saying that the situation isn't going to significantly improve from where it is now until boosters that are or vaccines are kind of tailored a bit more towards variants are brought forward. Is that likely, I suppose?
I mean, I haven't heard his view on that. He's not involved in our advisory group in the NPHET, so I'm not really aware of what his views are on those matters, and I don't have any comment to make. If I heard what he had to say and understood what he had to say, I'd be in a position to give you an intelligent view on that. I mean, if there's a question behind it that you're asking me, by all means, ask me.
Sure. Like that is, I suppose, in terms of the long-term view, I mean, it seems that we're kind of going to go in and out of kind of needing these measures. Like you said, there's even a small change in people's behaviour has necessitated yourselves come back and asking them to kind of more strictly adhere to the measures. So is that just kind of it for the foreseeable now? Because like that, most of the adult population is vaccinated already.
Yeah, you're right. I mean, most of the adult population is vaccinated with a vaccine that's very effective in the ways that we've talked about earlier on. The virus will continue to present a challenge as an endemic virus, where we will see, even at high levels of vaccination and with high levels of compliance with public behaviour, we will see continuing surges of infection that, let's say, are problematic in terms of either the impact that they have nationally or the impact that they might have locally, their potential to become greater events and so on. So in the situation we find ourselves at the moment, we must take action collectively as a country, because the level of infection that we have is simply putting far too much pressure on public health in the first instance, too much pressure on the public health system, and resultant pressure in the public health system's inability to meet all of the other health needs that we know are arising in the population. And from our point of view, we must recommend action in respect of that to try and reduce that level of pressure. We simply can't cope with the continuing rising demand driven by a preventable respiratory virus for health service care, and in particular hospital care, and all the impacts that has. If we find ourselves in a situation then at some point in the future whereby transmission levels are much lower, what we'll then have to be is in a position to pick up local surges of infection that arise and deal with those as effectively as we can to prevent them from becoming established as much more widely based community transmission. And we will see those kinds of challenges, I think, occurring from time to time with this virus, even if we get back into much better levels of control than we're experiencing at the moment. And I think that's the challenge the virus is going to present to us for the foreseeable. And there isn't any kind of, as it were, magic way out of that at this point in time in terms of, let's say, extrapolating from the technologies that are available to us right now, whether those are vaccines or tests or whatever. There isn't a magic bullet. So the kind of the pattern, I think, of endemicity that we're likely to see is one whereby we hope we get this level of infection in this fourth wave under some level of control, and that would then be in a position to responsibly pick up and effectively deal with local surges of infection to prevent them becoming a more established patterns of community transmission, that we pick up the local fires before they become full forest fires. That will be but we will experience those local and perhaps Professor Smith might want to offer a perspective on that from the local point of view. Because it's at this level that people, expert public health people, and what they do in the first instance is going to be really critical in protecting all of us.
I think what we have seen over the whole course of the pandemic is that we have you do see pockets of I suppose community transmission in areas, and within that when you get a surge of infection, you see outbreaks maybe in your because of a social gathering, there's an outbreak in the community, then it feeds into maybe the local creche or the local nursing home or the local disability centre. So it just mushrooms really. So a number of cases become the multiplier effect comes into play, and then it comes to a stage where you get a lot of different geographical areas that are experiencing the same thing, and that gives rise to the level of instances that we now currently have across age groups. So it's really important that we really can actually extinguish this at the start. At this stage in the pandemic, we're at incidence levels now where we actually have to approach it from a population perspective, and that's why all of these population public health measures are really our defence at this stage. And we really have to focus in on our vaccination. I think we all have to thank the population of Ireland for being so forthcoming in the uptake in the vaccination. It's a fantastic achievement. There is a small proportion still unvaccinated, and we're continuing to worry about them. So if you're not vaccinated, please think about it and come forward to your local centre and get vaccinated. If you've had one dose, come forward and get your second dose. In addition, as I can't reiterate often enough, going into the winter season, particularly if you have respiratory symptoms, stay home, self-isolate until you know for sure it's not COVID-19. If it's another respiratory virus, please self-isolate or stay home until you're 48 hours symptom-free. In addition, it's all the basic public health measures that have protected us up to this, like our hand washing, wearing our masks, social distancing, and also having a properly ventilated room when you have a number of people in there. So once again, outdoors is much safer than indoors. All of these basic measures are really what help us at this stage, at every stage of the pandemic. But I think at this stage, really, we can focus at a population level whilst keeping an eye on all of the different population cohorts where the infections are happening. In my region at the moment, we have seen a considerable increase, particularly in the last 2 weeks. We've seen across the region, I cover Galway, Mayo and Roscommon, we have seen particularly an increase in Galway City and County. The number of cases have increased by 200 in the last week. So it is very concerning. We're all on an upward trajectory. My region is no different from any other region. And what we're seeing at this stage, it is affecting our vulnerable populations. So it is affecting our nursing homes. It is affecting our disability centres. It is affecting vulnerable people that need care. And at this level, this is where we all have to stop as a population and take note that what can we do to protect everybody around us, ourselves and everybody around us. And it's these basic measures that we can do at this stage to actually try and halt this progression, this upward trajectory, and try and control this current surge that we're in, because we are in a surge at the moment.
And then just for yourself, Dr. Holan, you're saying that your remit is obviously specifically focused on Ireland and the situation here. Is there not perhaps an argument that maybe your remit should be slightly expanded then, seeing as COVID is obviously it's a global disease, it's a global problem, and like that, I mean, the current surge is being driven by the Delta variant, which obviously came in from abroad. So is there not an issue here that yourselves in NPHET are taking a kind of, I suppose, local view to a global problem?
No, sorry, maybe I wasn't clear enough about it. Like, it doesn't extend to, let's say, the questions about things that fall under the remit of Irish Aid. Absolutely, we're involved in international cooperation. So ECDC is an example. So we have a member of my office who's on the governing board of ECDC, as each member state does. We participate in the advisory forum. We have links to both colleagues in Northern Ireland and the UK on an informal basis, given the post-Brexit situation we find ourselves in, and we maintain ongoing communication with the Health Security Committee, and we have continuing participation in that, and their new structure has been established at a European level, the so-called HERA board and so on, which I'm a member of myself. So we're active participants in all those kinds of formal and informal mechanisms of cooperation, because, as you rightly say, we're a small country on our own. We can't see ourselves responding to the disease in some kind of insular way. I'm simply saying that my remit doesn't extend to questions around aid for third world countries and things of that nature, which are different.
Okay, thank you.
Yeah, thanks, Paul.
Hi, Mark Coughlin from Prime Time.
Mark.
Question about the letter from last week that you sent to the Minister. Like, if I understood it correctly, NPHET considered a 3 to 4 week pause in the plan to continue reopening, and decided against it because there wouldn't be a significant change in the trajectory of the disease within that 3 to 4 weeks. At the same time, the modelling says that within those 3 to 4 weeks, you expect to see 150 to 200 people in ICU by sort of mid-November time, and 700 to 800 people in general hospital. So is that baked in now? Is that an inevitability now, if there won't be significant change in that time period? Is that what we should expect to see?
Yeah, I think that's kind of what we're expecting to see. Yeah, Mark, that's fair. We needn't necessarily experience all of it, but the trajectory we're on at the moment, if it doesn't change, is going to take us there. What gets harder to predict, and as you know, when you go beyond a certain point, it's almost like weather forecasting. Beyond a certain point, it becomes less certain. The various variables, if you like, that go into the models and the assumptions that are behind those are less certain. If you look back over how the model has predicted where we've come, the models in general terms have performed extraordinarily well. Where we now find ourselves tracking in some of the data that we have is, if you remember the 4 scenarios that we set out back in the summertime of between optimistic and pessimistic at the 2 ends and 2 central ones in between, we're tracking between optimistic and central 1 in relation to all of the measures with the exception of mortality. So the case numbers, the number of hospitalizations, the number of ICU admissions, all kind of following that trend. And the models that we've been doing in more recent times, looking more closely at questions of whether there is susceptibility to transmission in children at the same level as adults or at a reduced level, and then looking at scenarios in terms of levels of socialisation. And we seem to be tracking a model that essentially is consistent with the model that predicted a rate of growth arising from a low child susceptibility but higher levels of socialisation, and that's exactly what we're seeing. We know now that children are not as susceptible in terms of transmission. We know that we're socialising to a greater extent, and the data we've heard from Dr. Robertson is supporting that view. And we're seeing, if you like, almost the inevitable consequence of that in transmission. And much of that then, as you're asking, in terms of what that will lead to in terms of an increase in hospitalisation, an increase in ICU admission, is likely to occur over the course of the next number of weeks. And what we have to do is to try and do everything we can to try and turn as much of that possible. It's not inevitable, but it is going to be very hard for us to turn around. And so we took the view that we were considering, because an option that we could have considered was to simply, as it were, kick the can a few weeks down the road and see how things emerged. But hand on heart, we didn't feel that things would be improved substantially, such that and I would just take nightclubs as just an example of the kinds of measures that were to be considered, in most of society being open, of course, but nightclubs, an increase in activity in outdoor and indoor settings and so on were the remaining measures. But if we just take nightclubs as the example, we could say, we can't open nightclubs now and let's wait for 3 or 4 more weeks. It's hard to see that the conditions would be better such that you could open nightclubs without a dependence on the COVID. So we thought it was better for us to say, look, if we can recommend a strict adherence with the COVID pass, if we have strict observation and as much as is reasonably possible of behaviours around that particular sector, and look, there's a reality around the extent to which people can effectively practice public health measures in a nightclub situation. But if people factor that then into their personal behaviour, like we've been saying earlier, that if you're going to go nightclubbing, maybe you don't go nightclubbing every night of the week, and if you're planning to visit vulnerable people in your family, you don't do that after in the days after you've been at a nightclub, and you factor all that into your personal behaviour. We thought that was a more appropriate way of considering how best to advise people to deal with management of risk, not just at the individual level, but at the sector level, in the context of a society which, in effect, is now fully open.
So, if I understand correctly, then what you're saying is, if a lot of that is baked in, maybe not all of it, but if a lot of it is baked in, you don't foresee any reversal of the direction of travel in terms of restrictions, even if 700 or 800 people are in hospital by early November.
We're not planning on that basis, no. I mean, I'm not going to rule anything out, but no, I'm not predicting to you that we're going to see that, and that's not my expectation at this point in time. Yeah, that's a fair way of putting it. Yeah, I mean that was the basic premise on which we framed that advice.
Okay, and can I ask about mortality? I think
sure.
Stephen, I think it was asked earlier about it. Of the 67 deaths notified last week, how many occurred last week or are thought to have occurred?
I can get you that data, and you have it there, do you?
Yeah, so
good.
So we're obviously reporting week on week the cases notified. So 67 new notified, of whom 44 had a date of death in October, 9 in September, and 14 before September, are not yet clear exactly when they passed away. So the majority September, October.
I think last week at the press conference it was 16 were notified within the previous 7 days.
Yeah.
Are you seeing? Have you that number for this week?
So it's a similar figure. It's 14, 15.
Okay.
Yeah, something on 14, 15, or 16.
Just make one additional point.
14.
Sorry, Ron.
Yeah.
Sorry, go ahead.
14.
Just when I mentioned the thing about the two scenarios and the optimistic and the central one, the deaths is tracking below the optimistic, and I think it's at about 300 for the time period that we were looking at. But we think that may well be some of I think what you're driving at there, the kind of lag in reporting that might well catch up, we think.
On that, the modelling previously would model in expected mortality, but the published modelling hasn't included mortality in it for the last little while. Is there a kind of weekly expected mortality come mid-November if cases hit 700 to 800 a week?
What we'll do is we'll come back to you on that next week when Philip is with us in terms of the detail of what's planned in terms of future runs of the model. I mean, the last run of the models were in August to predict what might happen over the course of the last number of weeks since the end of August, and the models, as it were, haven't been rerun, and we've been watching what's been happening with the cases and how well they've fitted, and as I say, it's fitted into that pattern of somewhere between the optimistic and the central one of those scenarios. But Philip will be with us next week and give you a more up-to-date answer on what the intended plan is in terms of reruns.
A final question. Do you track or do you know what proportion of the current case numbers are symptomatic?
So there's a proportion where we don't know whether they're symptomatic or not symptomatic, but where it's reported at the moment 86% of cases are reporting that they're symptomatic at the time of test.
Okay, sorry, one follow-up to that. Does that not indicate that there's a lot of asymptomatic cases that aren't being detected now that previously would have been detected under the contact tracing process that was previously in place?
Well, I think for a number of months now, the clear message has been that if people have any symptoms, that they're to come forward. And what we're seeing is lots and lots of people come forward who are symptomatic. They may be symptomatic with COVID, but obviously there are many who are symptomatic with other respiratory viruses. So it's difficult to disaggregate that given the time of year that we're in. But certainly over the last number of months, we have seen a gradual increase from what was about a steady state of about 70% of cases being symptomatic up to now, as I say, about 86% at the moment.
Thank you. Thank you, Doug.
Thanks, Mark.
Hi, Niamh Griffin from the Irish Examiner. Can I start with schools maybe first? The schools going back next week, the buses will be at full capacity for the first time. Do you have any concerns about that? Sorry, now that the cases are a little bit higher, a lot higher.
Well, all the basic protective measures will still be what we're advising. As I say, there are lots of opportunities available to people now in terms of society that can offer opportunities for the virus to transmit. What we'll be doing is focusing over the course of the next number of weeks on what we see in terms of the patterns of transmission and the impact that has. And giving any further advice. At the moment, we're not focused on, let's say, specific measures around restrictions of activities.
Okay, no, I didn't mean closing the schools, but just the buses in terms of not having them at full capacity. That's not been considered or looked at yet. Okay. Okay, and Professor Smith, maybe just, we've seen a few schools closing recently, sort of off their own bat. Is that something that public health might see that could happen, that individual schools might have to close to control a local outbreak?
So any situation in a school where there is a potential outbreak, a risk assessment is carried out by public health, and all the necessary actions will be taken with regards to identification of the symptomatic cases, whether there's transmission within the actual classroom or not, whether the case is actually linked with community transmission, and the evidence would suggest that a lot of the transmission is actually outside of the school setting, it's actually in the home setting or at the social gatherings outside of schools to date. So all the necessary public health actions would be taken and would be communicated to the school principal and then thereafter communicated to the children.
Okay, so do you think it's sort of unlikely that we might see individual schools having to close down?
Well, schools have been open for quite a while now, and we have had a solid practice with regards to communication, with regards to risk assessments in schools, and this is something that we've been carrying out for quite a while now in conjunction with the Department of Education. So this risk assessment practice will continue where required in the schools that it is required.
And just a more general question. You touched on this earlier, that there was a lot of comment from medical social media over the weekend about let it rip, especially coming from hospital doctors who are, I suppose, seeing the rise in cases. Could you just comment on that a little bit more, just expand really on that there is a fear that we're sort of blaming the unvaccinated and saying, okay, let them get COVID and let the virus run?
I mean, there probably isn't a dictionary definition of what let it rip means, but I say what I would understand by it is that essentially we can allow the virus to transmit as it wishes, as it were, without the need for us as individuals or for society to put in place measures to prevent that transmission. And that isn't policy. I mean, it has on occasions in the past was much closer to policies that were practiced and advocated in other countries. That was never the practice in this country and isn't the practice in this country now. So there are a range of measures in place, as we say, both focused on individuals, and that's not to transfer responsibility to individual persons. That's unreasonable. But like, as I've said before, I mean, the government isn't going to wash your hands for you. Individuals ultimately, and their compliance with the measures, their adherence to the measures, their buy-in and so on, that's going to be critically important in shaping the experience that we have as a country over the course of the weeks and months as we go through the winter. And as we've heard, there has been slippage in terms of what are still high levels of compliance with many of the measures, but there has been slippage relative to where it was. And we know that the sectoral adherence to some of the measures, you asked me about school buses and so on a moment ago. I mean, compliance with mask wearing and all of these other protective measures on public transport is still going to be very, very high, where there isn't, as Dr. Glynn said earlier on, discretion around people's use of those. People are dependent on public transport. So in all those environments, we will need high levels of compliance on the part of the behaviour of the individuals, but also on the part of those who have responsibility for running those services and settings. And there is strong both messaging, support to the various sectors involved, oversight by way of enforcement activities happening across government to try to reinforce all of those behaviours. So it's very far away from what anybody would ordinarily understand as a let-it-rip policy, where we'd let the virus do whatever it wishes, as it were.
Okay, thank you.
Thanks, Niamh.
Orla O'Donnell from RTE News. Just two quick questions. Firstly, have you any specific concerns and advice about this weekend, given that it's Halloween? There'll be lots of young people getting together of all ages, and particularly in light of what you said about the 5 to 12-year-olds, and particularly as they'll be back in school on Monday.
Dr. Glynn has a family that's probably focused on this issue than mine.
Is he going to cancel?
No, I think it comes back to the basic measures, Orla. So people can trick or treat, people can do the things they normally do at Halloween, but maybe don't do it every day over the weekend. Maybe don't meet up with multiple different groups of children over the weekend. And the core message and the key message is that, and it will mean that some children are very disappointed this weekend, but if you have a sick child, then please isolate them and don't let them mix with other children, because RSV is circulating, because COVID is circulating, and flu will be circulating in due course. So it's not a message that any of us want to be giving, and it's not a message I'm sure that parents want to hear, but we do need to take the basic precautions. On the other hand, if we do take the basic precautions, there's no reason why people can't do the things that we normally do at Halloween very safely.
Dr. Houlihan, you were talking there about you don't see any reversal of the path that we're on in terms of restrictions, but you also said you're hoping and you're optimistic that the small measures that you're advocating will have some change. But if they don't, when are you going to call it? When are you going to say, I've got to do something, we've got to make stronger recommendations, we do have to recommend more lockdown?
I'm not going to put a timeline on anything. I'm not going to predict that we're going to be given in that situation. I'm simply saying that, look, the message for now has got to be on things that we know can work. And reinforcing that message, that's where our focus has to be, rather than holding some kind of threat that unless the following things happen, we'll be recommending a lockdown at some point in the future or some such thing. Nobody wants to be back there again, including us, finding ourselves in a situation where ultimately measures that were effective but were crude and had all sorts of negative effects were required to achieve control of a virus which we know can be achieved through high levels of vaccination, which we've already ticked that box, supported by a range of public health behaviours that are consistent with, just safer, as I said, most of the population doing most of the things most of the time. If we can get back to that, then we're optimistic. We can achieve a change in terms of the levels of transmission that we've experienced, or that we're experiencing at the moment, and the continuing increase that we're witnessing.
But do you envisage that there might be a point before Christmas that you're going to have to...
I'm going to, and being optimistic about it, I'm going to categorise that as a hypothetical question, which is not a reflection on you, but it's just that's the hope that we have, that will be a hypothetical scenario. There won't be a need for us to go back the road. So far, with few examples, countries that have achieved high levels of vaccination that are experiencing surges haven't needed to go back into those kinds of measures. We know our near neighbours are giving consideration to some kinds of further restrictions that might apply, and there's a debate happening, as I'm sure you know, over there around those kinds of measures. But they're in a very different situation to us in terms of both their historic experience of the infection and the impact that it's had, and the levels of transmission that they've experienced over the last number of months.
Thank you.
Thank you.
Gabia Gatavitsketa from the Irish Independent. Just to go back on that research from the ESRI, so it's 1 in 5 that don't take preventative measures when they're leaving the house. Dr. Holland, do you worry that you've maybe lost the public? I mean, that's 20%. That's quite a high figure.
It's not as good and as close as an adherence to the public messaging as we would like. But as I said to you, the combination of both still a high level, albeit reduced, compliance with adherence to public messaging combined with the vaccination is achieving a very substantial level of suppression on the transmission of this virus from a natural state of, as I say, 6 to 8 down to a reproduction number of probably less than 1.5. But it's still a growing infection at 1.4 or 1.5 or whatever it may be at this precise point in time, and we need to do more. It might not be a huge amount more collectively as a population, but it is going to be each one of us asking ourselves the question as members of the population, if you like, are we each doing as much as we reasonably can do? Is there more that we can do to both deal with our own individual risk, the risk within our families, particularly if they're vulnerable people within our families or among our loved ones or people we interact with, and within our communities, and particularly those then, as I say, people who've got sectoral responsibilities that can influence the environments in which we all socialise in or work in or whatever it may be. And if we can each kind of get back to a little bit of that, more focus on those basic public health measures and reverse some of the trends that Dr. Robertson has described here in terms of slippage. So it's not a sea change. It's not that like all of a sudden we have abandoned everything we were doing something well and we've all abandoned that. There's been a slippage, and small changes in those overall patterns of behaviour are enough to explain the change in transmission we've seen over the course of the last weeks and months of this so-called fourth wave.
Do you worry though that...
Sorry, Dr. Robertson, please.
Yeah, sorry, go ahead.
There's another question that we ask is to what extent do you value preventing the spread of the disease versus the burden of restrictions on yourself? So that might answer your question about whether people have just been lost. And the majority of people still say that preventing the spread of the virus is more important. So the attitude seems to be that prevention is really important and people are recognising the risk. There's just a difference in those mitigation behaviours. And there's also a significant proportion of the population who remain highly worried. So although worry has been going down, it's been a relatively gradual slope, and there's still nearly 1 in 3 who are rating themselves very, very worried about COVID-19. So there's a difference sometimes in the attitude then and the actual behaviour in terms of what people are doing.
Can I ask, because I suppose there's been really quite strict restrictions that have been put on people from the very start of this pandemic, and I suppose the vaccine was seen as the holy grail almost, and now that the majority of people are vaccinated, do you worry that maybe some people think, okay, I've gotten vaccinated and that's kind of it, I can do whatever I like now, that, they think that some of the restrictions might not apply to them?
And that's not a uniquely Irish thing. That's human nature, I suppose, and it's behind, if you like, some of the guidance that I referred to earlier on from the ECDC that talked about the importance of, even in high vaccination countries, maintaining a high level of adherence to the basic non-pharmaceutical measures, and to the extent then that countries are not well vaccinated, and there are many countries in Europe that are nowhere close to where we're at in terms of vaccination, they'll have a high continuing dependence on much more significant economic and social restrictions, or the need for potentially those to be reintroduced. And that's what we're observing across Europe at this point in time. There's no country, unfortunately, no population that has or will achieve a vaccination uptake rate that won't leave it in a position to depend to some extent on additional measures to support vaccination, such as the high level of transmission of this particular virus.
Of that then, I suppose the point that you made there, and you were saying earlier as well, vaccination not enough on its own to bring down transmission. So does that mean then some form of restrictions are likely forever?
No, because I mean, if we go back to the very basic things we would have said at the start in terms of messaging, the most effective front line in this disease is the individual who's motivated to and practicing and adhering to measures that we know work in terms of protecting transmission against transmission. And we've seen extraordinarily high levels of compliance with that basic advice all the way through the pandemic. It has slipped, and it waxes and wanes according to the levels of infection and the perceived risks that might exist in the population at a point in time. And often we've seen anticipatory behaviour where there's been changes in the population when people see the change in case numbers either up or down. We've experienced it, but it doesn't get away from the basic observation that across the 18 months or more of this pandemic, we've seen very, very high levels of adherence across the population to the basic public health measures. Our lives have changed and in many basic respects as a result of the behaviours that this has mandated for us. And we've seen now high levels of vaccination. And we know we're going to need to continue to have both of those. And with high levels of vaccination, with those behaviours, if we can get back to some improvement as we are advising and calling for in terms of our collective adherence to those. And as I say, if those people who have control of, and we hear many people in the media advocating for their sectors, advocating for the reopening of and the conditions for reopening of their sectors. And in many cases, they've achieved that, and they've achieved their objective in terms of reopening. If they can all now, in a sense, focus their energies on supporting their staff, their customers, by making their environments as safe as possible, adhering not only to the letter of, but to the spirit of the advice that's there, then we think that those measures will be sufficient to change the patterns of transmission without the need for, in a sense, the things that we had to do as a country in the past, many other countries had to do, to take the decision away from individuals in terms of the behaviour, to not allow certain behaviours to take place, not allow certain social activities to take place. Nobody wants to be back there where we have to do that as a population, and it needn't be so. It's still within our control.
But those precautionary measures, like the COVID passes, like mask wearing, for example, even though we have very high levels of vaccination in this country, we're still going to have to stick with those for quite some time, those precautionary measures.
Yeah, I think it's probably reasonable for us to say, like, we will need those in place, we think, for the forthcoming weeks and months to get us through the winter. Yeah, for sure, yeah.
Thank you.
Thanks, Gabby.